Welcome to GCE 206, Clinical Psychology, Study Session 1, Definitions and Scope of Clinical Psychology. Introduction. Everyone has his or her off days when they just don't feel like themselves. For most people, these feelings are usual and they don't last long at all. For some individuals, however, these feelings are more serious as they could suggest a mental or emotional problem. Clinical psychology is a wide branch of psychology that focuses on diagnosing and treating mental, emotional, and behavioral disorders. Some common disorders that might be treated include learning disabilities, substance abuse, depression, anxiety, and eating disorders. In this study, you will learn about psychology, clinical psychology, and scope of clinical psychology. Learning outcomes. At the end of this study, you should be able to 1. Explain the meaning of psychology. 2. Define clinical psychology. 3. Identify the scope of clinical psychology. Meaning of psychology. The World Health Organization 2007 has defined mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stress of life, and is able to make a contribution to his or her community. Clinical psychology is concerned with the assessment and treatment of emotional and adjustment problems in order to improve the mental health. Psychology's first major theoretical position came from the writings of Wilhelm Wundt, 1832 to 1920, a professor of philosophy who founded the first formal laboratory of psychology in the University of Leipzig in Germany in 1879. According to Wundt, psychology is the immediate conscious experience, one's experience or awareness of the content of one's own conscious mind. Psychology first should seek to understand the structure of the mind. Hence, before the 1920s, psychology was defined as the science of mental life. Later, John B. Watson, 1878 to 1950, the father of a psychology school of thought known as behaviorism, became very dissatisfied with how psychology was studied and thus emphasized and played down on the implicit, covert, and subjective phenomena then prevalent in psychology and replaced them with explicit, overt, objective, and observable phenomena, that is, things that could be objectively measured. From the 1920s to the 1960s, psychology thus became the scientific and objective study of observable behavior. Psychologists began to assert that psychology need never use the terms consciousness, mental state, mind, content, and introspection, since experiences such as sensation, emotion, or reflection that occur within the body cannot be observed. Psychologists rather emphasize the study of human behavior that can be observed as they respond to different situations in their environment. From the 1960s, however, psychology regained its earlier interest in the study of how the human mind processes and retains information. Hence, the definition of psychology expanded to include the study of the phenomenon of observable behavior as well as inner thoughts and feelings. Psychology has thus become the scientific study of behavior and mental process. Behavior is an observable action of an individual that we can see, describe, and even record. Mental processes, however, are subjective internal experiences triggered by the biological activities occurring within the brain and can be inferred from behavior. For instance, you can infer how a person is feeling by his facial expression or the tone of his voice. Finally, as a scientific study, psychology endeavors to examine phenomenon make observations and formulate theories, test the theories, and either accept, reject, or refine the theories in line with whether or not you are able to predict specific behaviors in the pursuit of your understanding of the nature of man. Psychology is a collection of diverse subfields broadly categorized into theoretical psychology and applied psychology. Theoretical psychology involves basic research aimed at increasing the scientific knowledge base that aids in the development of theories. Subfields in theoretical psychology include, but are not limited to, biological, developmental, cognitive, personality, and social psychology. Applied psychology, on the other hand, involves the use of psychology's concepts and methods to find solutions to present challenges in the respective fields where psychologists find themselves. It includes the work of industrial or organizational, sports, school, educational, and clinical psychologists, to mention a few. For instance, an industrial psychologist uses knowledge acquired in psychology to assist companies in the effective selection and training of employees, in designing marketable products, in enhancing the morale and productivity of workers, and in implementing systems. The clinical psychologist also uses the knowledge gained during the training to study, assess, and treat people experiencing emotional, psychological problems. Though there are several subspecialties in psychology, in this study, however, you will learn about the applied field of clinical psychology. The definition of clinical psychology. The nature and definition of clinical psychology has continued to evolve over the years. From its initial prime focus on assessment, evaluation, and diagnosis, clinical psychology has grown to now comprise a variety of approaches to rendering treatment and prevention services to individuals, groups, and families. Given the evolving nature of clinical psychology, any definition of the field ought to be taken as transitory and to be altered and restructured regularly to precisely mirror new advancements and emerging directions within the field. The term clinical psychology was first used by Leitner Whitmer in 1896 to refer to assessment procedures which were carried out with retarded and physically handicapped children. The establishment of the Vineyard Institute for the Investigation of Mental Retardation in 1906 and the Chicago Child Guidance Clinic of 1909 reflects the preoccupation of the pioneering psychologists in the clinical field with handicapped children. Several definitions of clinical psychology have been given by different psychological associations from different countries of the world. Some of such definitions will be considered here. The definition of the Society of Clinical Psychology of American Psychological Association states that the field of clinical psychology integrates science, theory, and practice to understand, predict, and alleviate maladjustment, disability, and discomfort, as well as to promote human adaptation, adjustment, and personal development. Clinical psychology focuses on the intellectual, emotional, biological, psychological, social, and behavioral aspects of human functioning across the lifespan in varying cultures and at all social-economic levels. To the British Psychological Society Division of Clinical Psychology, clinical psychology aims to reduce psychological distress and to enhance and promote psychological well-being by the systematic application of knowledge derived from psychological theory and data. The Canadian Psychological Association states that clinical psychology is a broad field of practice and research within the discipline of psychology, which applies psychological principles to the assessment, prevention, amelioration, and rehabilitation of psychological distress, disability, dysfunctional behavior, and health risk behavior, and to the enhancement of psychological and physical well-being. Clinical psychology focuses on the intellectual, emotional, biological, psychological, social, and behavioral aspects of human functioning across the lifespan in varying cultures and at all socio-economic levels. In the view of the New Zealand College of Clinical Psychologists, clinical psychology seeks to apply psychological understandings with individuals and families who may wish to change or develop, often for the alleviation of suffering and the achievement of their personal goals. The specialty of clinical psychology may also be defined as the branch of psychology which deals with the search for and the application of psychological principles aimed at understanding the uniqueness of the individual client or patient, reducing his personal distress, and helping him to function more meaningfully and effectively. Clinical psychology uses scientific methods that are reliable and valid to assess both normal and abnormal human behavior, and it involves developing and using evidence-based strategies for delivering mental health care services. The specialty of clinical psychology may also be defined as the branch of psychology which deals with search for and the application of psychological principles aimed at understanding the uniqueness of the individual client or patient, reducing his personal distress, and helping him to function more meaningfully and effectively. Resnick, 1991, defined clinical psychology as involving research, teaching, and services relevant to the application of principles, methods, and procedures for understanding, predicting, and alleviating intellectual, emotional, biological, psychological, social, and behavioral maladjustment, disability, and discomfort applied to a wide range of client population. Rodnick, 1985, also defines clinical psychology as the aspect of psychological science and practice concerned with the analysis, treatment, and prevention of human psychological disabilities and with the enhancing of personal adjustment and effectiveness. Clinical psychology is one of the newest professions concerned with the healthcare of people. Clinical psychology contributes something special in the way it looks at man as a unique whole person in social context, and with less emphasis on the damaged tissue or the malfunction of parts that can preoccupy the medical doctor. Clinical psychology thus justifies its place alongside other health care professions by providing a balance to the medical model and emphasizing the need to be included in the explanation and treatment of mental dysfunctions. Scope of clinical psychology. Clinical psychology has some scope, and these include the applied area, the scientific area, the professional area. You may first want to know what these various areas stand for and what clinical psychologists do as applied psychologists, as scientists, and as professionals. This, therefore, is the subject of this lecture. Clinical psychology as an applied discipline. Clinical psychology as an applied area of psychology, because of the fact that it has derived most of its techniques, that is, scientific techniques, from its parent area, general psychology. Clinical psychology thus uses scientific methods as research, naturalistic observations, clinical case methods, diagnosis, and instrumentation in the diagnosis, treatment, management, and rehabilitation of maladaptive individuals. Thus, clinical psychology is said to be an applied field because it uses theories developed in general psychology to solve human problems. Some of such problems are asthma, tension headaches, and migraine, colitis, irritable bowel movement, chronic pain of psychogenic origin. Others include ulcers, obesity, psoriasis, tics, stuttering, autism, developmental disabilities, learning disorders, smoking, drug abuse, phobias and anxiety states, impotence and premature ejaculation in males, frigidity, vaginismus, and anorgasmia in females, all of which are subsumed under psychosomatic, cardiovascular, respiratory, sexual dysfunctions, and endocrinological disorders. These psychological problems have been successfully treated and managed by the use of theories of learning, perception, motivation, personality, and psychopathology in accounting for both normal and abnormal behavior. Clinical psychology as a scientific area. The goal of any scientific enterprise is to explain some aspect of the natural or social order in a logical and understandable manner. Science is often defined as the development of knowledge in an empirical, validated, and replicable manner. The three defining features of science are the development of a general theory, the testing and empirical validation of the theory, the replication of tests of the theory. Because of the foregoing, scientific inquiry is thus the keystone of every psychologist's formal education. The clinical psychologist is taught to assume a detached and an objective attitude in his investigative research and to take nothing for granted without experimental verification. He learns to design rigorous experiments with careful controls and to analyze his results with the appropriate, precise, quantitative measures. The ultimate aim is to contribute theoretically by producing hypotheses which themselves will continue to undergo scientific scrutiny. The clinical psychologist, who is better equipped in terms of vast knowledge in research methodology and advanced statistics to carry out clinical research than any of his mental health colleagues, including psychoanalysts, psychiatrists, psychiatric social workers, or psychiatric nurses and occupational therapists, carries out clinical research in at least 6 areas, viz. 1. Personality. 2. Psychopathology. 3. Relationship of social factors and psychopathology. 4. The biochemistry and genetics of psychopathology. 5. Clinical assessment of individuals. 6. Psychotherapy. Clinical psychology as a profession. Every profession has certain rules, regulations, ethics, and norms guiding the entry, qualification, and professional practice of the professionals. Therefore, the clinical psychologist, as a fully functioning professional person, has certain characteristics, attributes which include: he renders services, he adheres to a code of ethics, he possesses at least minimum standards of competence based upon specific attainments in the areas of knowledge, skills, and values. He has a firm sense of identity as a member of his profession. He is an emerging, growing person in the pursuit of his professional functions. He is committed to the advancement of the basic scientific substrate of his profession. He is concerned with training, with the professional preparation of the younger members of the calling who will succeed him. He is concerned with and participates in the organizations which order the existence of his profession. Summary of study session. In this study session, you have learned that 1. Psychology's first major theoretical position came from the writings of Wilhelm Wundt. 2. Clinical psychology focuses on the intellectual, emotional, biological, psychological, social, and behavioral aspects of human functioning across the lifespan in various cultures and at all socio-economic levels. 3. The definition of the Society of Clinical Psychology of the American Psychological Association states that the field of clinical psychology integrates science, theory, and practice to understand, predict, and alleviate maladjustment, disability, and discomfort, as well as to promote human adaptation, adjustment, and personal development. 4. Clinical psychology has some scope, and this includes the applied area, the scientific area, and the professional area. 5. The goal of any scientific enterprise is to explain some aspect of the natural or social world in a logical and understandable manner. We have come to the end of study session 1. Thank you.